Hello everyone, and a warm welcome to our July edition of our monthly newsletter, in which we provide a brief update of some of the health awareness events for this month. My name is Sabine, I'm the Community Engagement Officer, and I'm joined by Tanya, our Director of Community Health, and she's joining me this month. Hi Tanya.
Hi Sabine, thank you for the invite.
No worries at all. Now we've got a few subjects to discuss this month, but firstly, Tanya, can you please tell us a little bit about yourself and your role at TDHS?
Okay, as the Director of Community Health here at TDHS, I have operational oversight of the community health team, which includes our district nursing service, the community care team, allied health, community engagement, and the Timberine Clinic also falls under my role. So a very mixed and varied role, but thoroughly enjoyable.
And are you from this area, Tanya?
Originally I'm from the Western District, a small country town called Wallora, and have spent probably the last 15 years living in Western Australia and the Northern Territory, but returned home in late 2019 with my family.
Have you been enjoying the winters here?
Well, I wouldn't say they're pleasant, Sabine. It's been 15 years since I've owned a jumper, so it's been an adventure again to acclimatise to this delightfully cold weather.
And that's what's lovely. We're sitting in the sun today. So
very fortunate we are today.
Yes. Now, as you manage, as you said, amongst others, allied health, and which includes all the exercise classes and our social support group, with the latest changes that is happening around the country, how does that affect those certain groups?
Well, COVID and everything COVID's just ever evolving, isn't it, across Australia and all the states and territories within Australia, and of course all of the regions within those states and territories. So it's a complex sort of space to navigate. And what's operationally viable for one health service with regards to services that they can run, or the suite of services that they hold and can continue to serve, is dependent on that state or territory's restrictions. And of course, here at TDHS we have some aged care residents, so that means that our restrictions are probably a little bit tighter than most other health services that surround us. So we've been able to continue most of our allied health services under the strict guidelines, mask wearing, social distancing, room density requirements, and of course the restrictions we have with people entering our health service. But unfortunately for groups like social support group and exercise classes, we've had to put a hold on them, and that hold remains and will continue to remain until the guidance from the Victorian Department of Health is given that we can recommence the classes.
Yep, no, that makes sense. I think kind of people forget that we have got aged care here as well, which means that we're under stricter guidelines.
Yeah,
with regards
absolutely.
to that.
So we can have different health services in the same region operating different classes because of the suite of services that they offer. I think that's really confusing for some people.
It is, yeah.
Or makes it confusing.
And that makes sense, what you're explaining. And so, what's happening around the country shows that COVID isn't going away. And so it shows again the importance of getting vaccinated, isn't it?
Yeah, absolutely. Getting vaccinated is really important because it helps protect you and those around you from getting seriously ill from COVID-19. And, it's effective. So I think it's really important that we encourage people to get vaccinated, and currently our Timberine Clinic offers AstraZeneca vaccinations, and all you need to do is simply call the clinic on 555 86 088 and make that appointment.
And even if you have been vaccinated, even your double dose, it's still very important to look out for those very mild symptoms, isn't it?
Absolutely. Any symptoms at all, I think it's really, really important, and we can't underestimate how significant it is that we actually get tested even with the mildest of symptoms.
Yep.
And we're fortunate here because both the health service and the clinic can actually do that testing.
Yep.
For you. All you need to do is simply call and make an appointment. So the same number for the clinic, 555 86 088, and of course for our health service, 555 86 000.
Yep, great. Our National Diabetes Week is from the 11th to the 17th of July, and it promotes to have a conversation about the real impact diabetes stigma can have on a person's mental health and emotional well-being. Now this is something that I didn't really know much about, and it's not really often talked about, is it, Tam?
Correct. Sabine, that's. I was quite surprised when when we were prepping for this. Okay, so this year the Heads Up campaign continues to put that spotlight on what you just discussed. The stigma about diabetes, and of course the mental health challenges that can come because of that. So things like people feeling or being blamed for certain situations that they're in because of their medical condition. Some people feel uncomfortable when they have to inject insulin and they're in a public setting, or, they've got low blood glucose, so their energy levels might be low, and there might be some judgments around that from others who maybe don't understand the circumstances for that individual. And I think, statistically 4 in 5 people who have diabetes have experienced the stigma, that stigma that we just discussed. Wow. And nearly 50% of those people have actually had mental health challenges in the last 12 months. So it's not something that can be just brushed away or not considered. It's actually quite serious and quite prevalent.
Yeah, it is, isn't it?
Absolutely.
Yeah, it's like I said, it's something that I didn't actually realise, so it's good to know. And they actually are holding some events, Diabetes Australia, online, aren't they?
Yep. So on Tuesday the 13th, there's a forum called Heads Together Forum, and it's running from 7 to 8:30 p.m. and basically it's an online discussion about the mental health challenges and also the stigma with diabetes that people may experience or face, I suppose. Yep. So more information for that about this whole thing can be found on the Diabetes Australia website. So I'm sure that'll be flashing across the bottom of our screen as we speak.
Yep, no, it's good to know about that and get some more information and people start talking about it.
Absolutely, because if we're talking about it, then we're actually working together to make sure that we're all aware of it, and then the judgment may disappear or decline.
Yep.
I think it's also really important to mention, Sabine, that we actually have a diabetes educator on staff here at TDHS, and that individual works every Thursday. So to make an appointment with her, you just simply need to call that 555 86 000 number and make an appointment through reception.
Yep, and that's with Cheryl Paul, isn't it?
Yeah, Cheryl. Yep.
No worries. Now, National Farm Safety Week is run each year in the 3rd week of July, and it raises awareness of farm safety issues on rural communities across Australia. Being part of a farmer's community means that our urgent care centre receives quite a few of some farm incidents that happen here around the district, don't they?
We do, yeah, absolutely, Sabine. And our winter quarterly features 2 farm incidents that have been experienced by 2 of our local community members in Dennis Horn and John Wilson. So these stories just remind us how quickly things can turn in a situation on the farm and the importance of farm safety in everything that they do on the farm. Yep. So Farm Safe Australia are running a National Farm Safety Week, which runs from July 18th to the 24th. And this is just a week that brings awareness to all of the issues that they face on the farm for the people who are working the farm, the families of those who are working the farm, and people who come to our farms to work within Australia.
Very important information. I guess people have been working on farms for a long time and do things a certain way and get a little bit in an automatic kind of way of doing things. True. and thinking of different things, and it's very quickly, accidents do happen very quickly that way. So.
Absolutely. So Sabine, this month is Kind July. And it's an initiative that is it's a very powerful message, I believe, and something that's really, really close to your heart.
It is. It definitely is. The power of kindness is something I really strongly believe in, and I normally sign off with saying to people to be kind to yourself and each other. I just think it's very important, and I discovered Kind July last year, where I found that it's kind of a sad initiative initially. It was founded by the Kelly family as an unkind world caused their sons Thomas and Stuart, both 18, and to lose their lives 4 years apart. One by a one-punch attack that was Thomas and Stuart by committing suicide caused by bullying. So it's very sad how it started, but the Kelly family thought that if they can make the world just a little bit kinder, and if it had been kinder, that Thomas and Stuart would still be here. So it's kind of a legacy to these two young people, and I think a very important message that kindness is, it can be such a small thing that we do and have such a big impact on people. Because if you actually think about it, if during the whole month of July, if every Australian does one act of kindness every day in July, even opening the door for someone or saying hi to someone or letting them in front of you in traffic, that means that actually 775 million acts of kindness are being done. And if you spread that out over a whole year, it runs into the billions. So
significant.
It's very significant. Please don't underestimate how just that little act of kindness can change someone's life and sometimes even save someone's life. So that's why it's just very close to my heart, because it's a small thing we can do, but it has a very big impact.
Absolutely.
And every Thursday in July at 7 p.m, Stay Kind, the organisation, will be hosting special online events. They're called Stay Kind Conversations, and you can join online and register. And you can also make your pledge of kindness on their website, which will be showed on the bottom of this page. Very important message.
Absolutely. And something that we can all partake in, which I think is critical, or essential really. So the community that we have has certainly shown their kindness recently by jumping on board our annual appeal fundraiser for Social Support Group Bus. So I think it's wonderful, Sabine.
Oh, it's been absolutely amazing, the response we had. So many people have jumped on board to donate to this wonderful cause.
Yep.
Just to explain again, a bus for us will mean that we can run 4 social support group days a week. So we've got 2 in Cobden, 2 in Timboon. The Timboon people can be collected to attend the Cobden days as well, and vice versa. It'll free up community transport volunteers that are currently taking them to the different days. And so they can attend to other community members for vital appointments. It'll have proper disability access where that wheelchair actually goes forward and people sit forward in their wheelchair and be included facing the same way as everyone else instead of sideways. It will also mean that we can run it in our own time, so it doesn't have to be back at certain times. We can take it for different days, so it doesn't depend on availability and time. So
excellent.
it's just it'll be really good, and ongoing cost have been planned for, and we aim where possible for these costs to be spent in the community as well. So if community members would like to make a donation to a cause, please consider our annual bus appeal. You can donate online, via mail, or at our front desk at reception. But also if you have any queries or concerns, you need any more clarification, please give us a call on 555 6000, and we're happy to discuss and clarify. Thank you, Tanya, for helping me out with highlighting some of the events that are happening in July. Thank you very much.
That's my pleasure.
And thank you, our lovely community, for joining us. Please keep on checking our social media for our posts about other different awareness events and community stories. Please continue to be mindful of yourself and others, and that's mentally and physically. Together we can keep us safe and keep our community and district open. Please stay apart, stay safe and stay kind as we work together for a healthy community. Thank you, and thank you, Tanya.
Thank you.